for coming to my presentation. I would like to talk about the unpredictable disease of multiple sclerosis. I'm sure you've all heard of this. It's commonly referred to as MS. In February 2019, actress Selma Blair spoke out about her struggles with MS to raise awareness of this terrible disease. I think it's important to know the knowledge of the disease so that we can recognize the signs and the symptoms. So to understand MS, let's look at the definition, signs and symptoms, diagnosis, and treatment. The definition from Medline Plus, the U.S. National Library of Medicine, is multiple sclerosis is a nervous system disease that affects your brain and spinal cord. It damages the myelin sheath, the material that surrounds and protects your nerve cells. This damage slows down or blocks messages between your brain and your body. So now that we know what MS is, let's look at who's at risk. Women are at a much higher risk than men. They get diagnosed 2 to 3 times more than men. The onset of symptoms usually is between the ages of 20 and 50. Genetics plays a part because if you have a relative who has been diagnosed with MS, you are at a higher risk. MS is not a death sentence, but if you do get diagnosed, the average lifespan is 35 years after that diagnosis. So let's look at some of the symptoms. Selma Blair interviewed with Good Morning America in February of 19. She said it's called the snowflake disease because it's different, like a fingerprint, for everyone, and not one size fits all. The first symptom that usually occurs is visual disturbances. This would be blurred vision, maybe blind in one eye, maybe double vision. The most common symptom is fatigue, and it could be just complete exhaustion. In Selma Blair's case, she said that when she would drive her son to school, which was less than a mile away, she would drop him off, and on her way home to drive another mile, she was completely exhausted, and she would have to pull over and actually take a nap. So in her case, you can look at her symptoms. For example, she had coordination issues and loss of balance. She needs to walk with a cane. She needs to stand with a cane for support. She's had tremors, and she has speech issues, so it takes her a long time to get a sentence out. She has not a stutter, but she has a lot of speech impairments. There are also exasperating factors that worsen your symptoms and make them feel just much worse. Examples of this are extreme temperature changes, so overheating, exposure to cold, even so little as a fever could aggravate your symptoms. You could take a hot bath and that could aggravate your symptoms. If you have infection or stress, that worsens symptoms as well. And women that have just given birth in that postpartum period tend to get their symptoms. So what is the diagnosis? The National Institute of Health, part of the U.S. Department of Health and Human Services, say MS is usually diagnosed when people are young adults, but it can be diagnosed at any age. No one knows exactly how many people have MS. In the United States, at least 400,000 people do. So why is it so difficult? There's no definitive test, meaning if you go to the doctor for anything else, you can get a throat culture, you can get a urine test, you might get a blood test to find out what you have. With MS, this doesn't happen. Doctors have to look at history and a physical exam and look at your medical history to determine when you got the symptoms. Are they related to MS? There are MRIs that they can take where doctors can look and see any changes in the brain. The most important criteria for diagnosis is that they will not diagnose you with MS until all other diagnoses are ruled out, which is why it takes a long time. Treatment. There is no cure for MS. So treatment is just to help you with symptomatic and support your symptoms. The goals of this are to make the symptoms calm down. They want to delay progression. They want to manage your symptoms, and they want to treat the exasperation so that they don't occur as often, or maybe not at all. There are medications, and the medications are to modify the progression and also to prevent relapses in the symptoms. And when medications don't work and that's your last resort, there are some surgical procedures that can help some of the symptoms. I hope that you all have learned a little something about MS, so that going forward you would be able to recognize some signs and symptoms. Does anyone have any questions?
If you change your diet and exercise, can it alleviate your symptoms?
I actually have a friend who was diagnosed with MS about 10 years ago, and after her diagnosis, she was having a lot of back pain. She went, she's a vegetarian now. She's completely changed her diet, and she exercises regularly, and she does not have those back pains anymore. I don't know if it's, for everybody, but for her it worked, yes.
My uncle was diagnosed with MS when he was 65. Is that rare to be diagnosed that late?
I would say probably, because the common age, it's mostly diagnosed between 20 years and 50 years, plus it's more common in women than men, so I would think probably.
Okay, thank you.
Thank you, everyone.